I'd been working as a night nurse at St. Mary's General for 3 years when everything changed. The night shift was always quiet, but there was something different about the atmosphere that October evening. The hospital felt heavier somehow, like the air itself was holding its breath. I was assigned to the 4th floor that night, the medical ward. Only 6 patients, all stable, all sleeping. My supervisor had called in sick, leaving me completely alone for the 12-hour shift. I settled in at the nurses' station, reviewing charts and trying to shake the uncomfortable feeling that had been following me since I'd arrived. My first rounds went smoothly. Room 401, Mr. Henderson, recovering from pneumonia. Room 403, Mrs. Chen, post-operative observation, all sleeping peacefully. But when I reached room 405, I noticed something odd. The patient, an elderly man named Robert Walsh, was staring directly at the ceiling with wide, unblinking eyes. I checked his vitals, everything normal. His breathing was steady, heart rate regular. But those eyes, they never moved, never blinked. I gently called his name, touched his shoulder. No response. I'd seen catatonic states before, but this felt different. There was an awareness in his gaze that made my skin crawl. I returned to the nurses' station, but I couldn't concentrate on my paperwork. Every few minutes I found myself glancing down the hallway toward room 405. Around 2 a.m. I decided to check on Mr. Walsh again. As I walked down the corridor, I noticed that several other patient room doors, which I was certain I had left closed, were now slightly ajar. Room 402, 404, 406, all the doors I remembered closing were now open just a crack. I told myself it was the building settling, changes in air pressure, but as I passed each room, I could feel eyes watching me from the darkness within. Not the patients. They were all clearly asleep. Something else. Mr. Walsh hadn't moved an inch. Same position, same unblinking stare. But now I noticed something that made my blood run cold. His lips were moving slightly, forming silent words. I leaned closer, trying to understand what he was saying. The movements were so subtle, so rhythmic, like he was reciting something over and over. I stayed with him for nearly 10 minutes, watching those silent words form on his lips. Finally, I thought I understood what he was saying. They're coming down the hall. Over and over again. They're coming down the hall. I felt ice in my veins as I slowly turned to look out into the corridor. The hallway looked empty, normal. But as I stared down toward the nurses' station, I realized what was wrong. The silence was too complete. No hum of ventilation, no distant elevator sounds, no electronic beeping from other rooms. It was as if the entire floor had been wrapped in cotton, muffled from the outside world. That's when the lights began to fail. Not all at once. They went out in sequence, starting from the far end of the hall and moving toward me. Click, click, click. Each section of corridor disappearing into darkness, like something was walking down the hall, extinguishing lights as it passed. I spun back to Mr. Walsh. His lips were moving faster now, more urgently. They're coming down the hall. They're coming down the hall. The heart monitor showed his pulse was still normal, but mine was racing. I grabbed my phone to call security, but there was no signal. No bars, no connection to the outside world. The lights were almost to our room now. I could hear something else, a sound like whispers, Dozens of voices speaking in unison. Too quiet to understand, but growing louder. Mr. Walsh's eyes suddenly snapped to mine. The first time he'd acknowledged my presence all night. His mouth formed different words now. Don't let them see you. I killed the lights in his room and crouched beside his bed. The whispers were in the hallway now, right outside the door. Multiple voices, speaking in perfect synchronization, but the words weren't in any language I recognized. Mr. Walsh's hand found mine in the darkness, ice cold, but reassuringly human. We waited in absolute silence as the voices passed by the room. After what felt like hours, the whispers faded. The lights flickered back on, one by one, returning the hallway to normal. I looked at Mr. Walsh. He was sleeping peacefully now, breathing regularly, looking like any other patient. When I checked his chart the next morning, I discovered he'd been in a medically induced coma for the past week. I submitted my resignation that morning. The day shift supervisor said Mr. Walsh had passed away peacefully around 6 a.m., natural causes. But I know what I experienced that night. Sometimes, in the quiet hours before dawn, the boundary between life and death becomes paper thin, and some patients see what's coming long before the rest of us do.